Are you confused and overwhelmed by Medicare? Well, in today's video, I'm going to make Medicare as simple as I can over the next few minutes. What's up, friends? Rob here, the Medicare Minister with Agape Insurance and Financial Group in North Mississippi. And in today's video, we're just going to take a few minutes to break down the foundation of Medicare to give you a better understanding and hopefully point you in the right direction. Now, before I dive right in, at any time during this video, you can call the number on the screen. It will also be in the video description, or you can fill out the contact form below, and either myself or one of our seasoned advisors would be more than happy to help consult you at no cost and no obligation to you. So let's start here. Original Medicare. Are you eligible? And it says here, if you or your spouse have worked a minimum of 10 years or 40 quarters, according to Medicare's guidelines, then you qualify. Now, let me just be very honest right here out of the gate, so that way we can eliminate any confusion or any worry. Most people are going to qualify for this. It's very rare that I have run across anyone that did not qualify for Medicare. Qualifying events: if you're turning 65 today or you're getting ready to turn 65, then chances are you've been getting all these letters in the mail, emails, seen all these ads on social media, commercials all over TV telling you this is the best option, that is the best option. And so today we're going to simplify that. Or maybe you're going on disability today. Maybe you've been disabled for 24 months and now your 25th month is about to click over and you now qualify for Medicare. Maybe you're coming off of group coverage because you've worked past the age of 65. This is very common nowadays that many Medicare beneficiaries are working past their 65th birthday, or unfortunately, maybe you've been diagnosed with end-stage renal disease. So these are the qualifying events if you are going on Medicare or you're new to Medicare. How do you enroll in Medicare? Well, there's the numbers here on the screen, the Medicare hotline number, 1-800-MEDICARE. Also, the Social Security hotline number you see there on the screen. If you're tech savvy, then you can also go online and enroll in Medicare this way. Now, a couple of things I want to make a mention on this slide here is if you are on Social Security, you will automatically be enrolled into Medicare. If you are not on Social Security, you must actively enroll yourself. It just takes about 10 to 15 minutes. You see the link here on the screen. Fill out any kind of application for like a car or for a house. This should not be that hard for you to figure out. Now, one side note that I want to make here is if you are brand new to Medicare, you do not have to go on Social Security when you're going on Medicare. Now, I'm speaking primarily to those turning 65. Some people want to wait to their full benefit age. That's another video for another day before they take out Social Security. Okay. All right. Your initial enrollment period is 7 months. That's 3 months before your birth month, the month of, and 3 months after. Let's talk about Part A, or hospital insurance. Some people refer to it as inpatient insurance. There's no premium if you met those qualifications that we talked about in the very beginning of the video. Once again, most Medicare beneficiaries are going to qualify for a zero premium Part A. Also, there is a deductible that is associated with Part A, and you could be liable for that deductible multiple times per year. And that's one of the reasons why you want to either get a Medicare supplement or Medigap or a Part C plan. We'll talk about that more here in just a few minutes. So most people are going to qualify for Part A at zero premium. Part B is a different story. There's a premium attached to Part B, and that is $164.90 in 2023 when this video is being made, but it's going up to $174.70 in 2024. Now, one quick side note is if I do not go on Social Security when I go on Medicare, then they're going to bill me that $164.90 or that $174.70 quarterly. If I am on Social Security when I go on Medicare, they will bill that monthly and it will come out of my Social Security. Just like Part A has a deductible, Part B has an annual deductible. This year it's $226. Next year in 2024, it will be $240. So Part A is our hospital or our inpatient. Part B is our medical or our outpatient. The other thing that you need to understand is that Part B will pay 80% of my medical bills, which leaves me, the Medicare beneficiary, 20% left over. This is one of the reasons that we recommend that you go one of the two options that we're going to give to you here in just a few minutes, because you do not want to be responsible for that 22% because there's no cap, there's no limit on the amount that you would have to pay. Now let's talk about your two options. We have original Medicare or Part A or Part B with a Medicare supplement and our prescription drug plan or Part D plan. This is the nuts and bolts over here of original Medicare. And then we have option number 2, which is known as a Medicare Advantage plan that includes a prescription drug plan, or MAPD for short. It's also referred to as a Part C plan. When we look at original Medicare with a prescription drug plan, we are looking at higher premiums, but no copays or coinsurance payments. So let me give you an example. If I was to be on a Medigap plan or Medicare supplement plan, and I had my red, white, and blue with my Medicare supplement, then all I'm going to owe in that calendar year is, obviously I got to pay my premium, but all I'm going to owe is that Part B deductible. That, if you remember, is $226 this year in 2023, going up to $240 in 2024, and then my Medicare would pay $80, and then my supplement would pay $20. However, you have more skin in the game, so to speak. You also have the freedom to choose any doctor or any hospital as long as they take Medicare, which is pretty much everyone. All right, no referrals necessary. Here is one negative, if you will, and that is routine services like vision, dental, and hearing are not covered under original Medicare, so you would need to get those extra plans to meet those needs. And then it's covered anywhere in the U.S., limited services outside of the U.S. Now, let's look at the Medicare Advantage side that includes a prescription drug plan. Now, before I do that, real quickly, if you are getting value out of this video so far, please take a moment to like, comment, and subscribe. This just helps us reach more Medicare beneficiaries like yourself. All right, back to the regular scheduled program. So the MAPD, or Medicare Advantage Prescription Drug Plan, also referred to as a Part C plan, generally has lower premiums. In most cases, they're zero premiums, but they do have copays and they do have coinsurance, and they also have max out-of-pockets. To give you an example, where I live here in North Mississippi, those max out-of-pockets start around $5,900 per calendar year. If you do not know what a max out-of-pocket is, it's simply the most that I can be responsible for in one calendar year on this particular plan. They are network-based plans, and so this is very important when it comes to looking at a Medicare Advantage plan, because you want to check your doctors and make sure that all of your providers are in the network. Referrals for specialists are rarely required. The big pro that you see some of these commercials on TV and some of these ads on social media is that you get dental, you get vision, you get hearing, gym memberships, over-the-counter cards, and more, which can be a great thing, especially if you're on a limited budget and don't have the extra money to enroll in those extra ancillary plans that you may need to address those needs. All right. And emergency services are covered worldwide. All right. So let's look at a comparison here. Medicare supplement versus Medicare Advantage plan. If we look at our Part A, zero cost for most people, but I have a $1,600 deductible that I could have to meet multiple times per year. I do have a Part B premium of $174.70 in 2024. This year it's $164.90. And then I have a Part B deductible that I have to meet. That's an annual deductible, and that's $240 for next year and $226 for this year. The most popular plan is a Plan G. This is a Medicare supplement or Medigap plan. Same thing. And generally they run about $100, and they go up depending on which carrier that you decide to go with. Quick side note is you want to work with a Medicare broker and not what's known as a captive agent. It's not because captive agents are bad. It's because they only represent one company. And a Plan G or a Medicare supplement plan in, or whatever plan you decide to go with, is the exact same no matter which company you go with. And so you don't want to pay more for something if it's going to do the exact same thing. So a Plan G is the most popular Medicare supplement plan, and they start around $100 and go up. Your Part D plans, believe it or not, starting in 2024, There's going to be a Part D plan that's literally 50 cents per month, and they go all the way up to over $100 per month. And then, as I stated earlier, original Medicare does not cover these extra benefits that you may need in order to address some healthcare needs like dental, vision, hearing, and any additional cancer benefit that you may need for like miscellaneous cost or prescription drug cost. All right, Part C, or the Medicare Advantage plan, is generating zero or lower premiums. They have a max out of pocket, which we discussed briefly earlier. It's going to depend on where you live and what the carrier you decide to go with. They do have co-pays and co-insurance as well. But the good news, once again, is that they include extra benefits like dental, vision, hearing, gym memberships, and so on and so forth. So I always tell people the original Medicare side is going to require that you have more skin in the game. You're going to pay a little bit more, but it's going to be a better coverage in regards to the freedom that you have, and you're more in control of your health care. The Medicare Advantage plan can be a good plan for those that are on a very limited budget. Maybe you're extremely healthy and you do not have a medical history that proves that you could have some challenges. I know we never know, but there are some really healthy people that choose this route. Or maybe you just don't really have anything at all to work with and you want to get something to protect and to shield yourself, then the Medicare Advantage plan or Part C plan could be the best fit for you. Now, the last thing before I close out this video is if you do decide to go the Part C route, the Medicare Advantage route, we strongly recommend here at Agape that you get what's known as a GAP plan or a reimbursement GAP plan. The official name is a hospital indemnity plan. And the reason for that is the Part C plans have gaps in it. They have co-pays that you need to be aware of, and you can put another plan in place, this hospital indemnity plan, to shield yourself against that. Daily co-pays for the hospital. If you were to go inpatient and you read the fine print, you're responsible for the first 5 to 7 days in the hospital. Also outpatient surgery co-pays, ER visit co-pays, and ambulance co-pays. So we strongly recommend that you consider a GAP plan to give yourself that extra protection to make sure that you're not caught off guard if you decide to go this route. Now, the last thing I'll mention here when it comes to a Medicare Advantage plan, because this is a very popular question we get all the time. Do I still have to pay my Part B premium if I go through the Medicare Advantage route? And the answer is yes. The only way that you can get out of, I should say, of paying that Part B premium is to qualify for the Medicare savings program, and either myself or one of my team members would be more than happy to see if you qualify and even apply for you. You can do that simply by calling the number on the screen. We also have the number in the video description as well as a contact form, and all of this can be done for you at no cost. So whether you just need someone to help you navigate what's the best option for you, or maybe you need a little bit more comprehensive overview of Medicare, or maybe you need to apply to see if you can get that $164.90 back for this year, $174.70 for next year, myself or my team would be more than happy to do that for you at no cost or no obligation. Once again, the number is on the screen. Well, God bless you guys, and thank you for watching today's video, and we'll see you on the next video.